We are just initiating in a minute.
Okay.
Yes. So, hello, good evening, everyone. Myself, Himanshu Sharma, on the behalf of Team Physio Inculcator, I would like to welcome you all in our today's session. Today, we have a very special resource person, a very senior and expert resource person with us, Dr. Akhilesh Sahu sir. Dr. Akhilesh Sahu sir, he is here to share their expertise on the topic healing by manual medicine. Today, in this webinar, Dr. Akhilesh Sahu would be sharing with us their expertise on the topic, and they are about to cover the significance of being a human, how to reactivate the self-healing mechanism via manual medicine, the mind-body mechanism, psychoneuroimmunology, body signaling system, psychosomatic dysfunctions, principles of manual medicine, and the models of manual medicine. So here we have a very senior and expert resource person with us to share their expertise on the topic. Dr. Akhilesh Sahu sir itself is a very renowned person in the field of physical therapy. But let me take a privilege to introduce our resource person of the day, Dr. Akhilesh Sahu sir. Dr. Akhilesh sir is the director of Golden Physical Therapy and Wellness Institute, which has been awarded best in the Central India and located at the Raipur, Chhattisgarh. Dr. Akhilesh sir is also a General Secretary of the Indian Association of Physical Therapy, Chhattisgarh branch. Dr. Akhilesh Sahu sir is having an outstanding academic record and and her numerous contribution in the field of research as well as in the field of clinical physical therapy. Dr. Akhilesh Sahu sir has done their post graduation in the musculoskeletal physical therapy. He has done their COMT from Australia, FIOR from Apollo Hospital, New Delhi, FLTT from AIMS, New Delhi, MD in acupuncture from TCM, MD in natural medicine, as well as he has also done their doctorate in the natural medicine from London, MD in the mind medicine, and now currently pursuing the PhD in the mind medicine from USA. Dr. Akhilesh Sahu is having 4 PGs and many other numerous certification courses, and Dr. Akhilesh Sahu sir is having around 18 years of the clinical as well as academic experience. He has contributed around more than 10 journal publication by their name in national as well as international journals, and he has delivered the talk in the national as well as international conferences at around more than 15 occasions, more than 15 international conferences. So we are really honored to have Dr. Akhilesh Sahu sir with us on the board, and we are really thankful and grateful to Dr. Akhilesh sir that they agreed to share their incredible knowledge on the topic of their expertise, the healing by manual medicine. In spite of having their busy schedule, they spared their uh, very incredible time to share their knowledge with us. We are really thankful to you, sir, for your knowledge sharing. I would like to welcome to you from the core of my heart. Welcome to you, sir. Over to you, sir.
Thank you so much. So I can continue.
Yes, sir. Yes, sir. Stage is all yours, sir.
Okay. So, okay. So good evening, all of you. First of all, I would like to thank the organizers, the team of Physio Inculcators, for in this today's topic. The topic is healing by manual medicine. So in this segment, definitely we are discussing a lot of new terms. When you see any new term, then don't worry about that. At the end of the time, definitely will connect all dots clearly. So you will be able to connect the all dots if there is any new term come in front of you. So just listen that and try to understand the new concept, because it will help a lot in our practice, and you can say that this is the future of medicine. So I'm going to present the healing by manual medicine. First, we'll discuss the self-healing mechanism. So as I stated that in my preview, that how we can reactivate the self-healing mechanism through manual medicine. So when we talk about the self-healing mechanism, the things comes in our mind and how it's possible. We heard it from last so many decades, but we don't know how it's possible to reactivate the self-healing mechanism, and only through the manual medicine. There's a lot of way to activate the self-healing mechanism, but here we are discussing in the preview of manual medicine. So to understand this topic, first we need to understand the existence of our self, human existence. So we always hear in the term of human being, not only the human, we always heard about the human being pattern. So what is the meaning of human? So human, that means you can say that is a combination of anatomy and physiology, and this is our body. But what is the meaning of being? So to understand this term, we need to understand in this whole universe, every single modalities or any gadgets we are using. We are using fridge, TV, AC, and right now mobile. So these all are particles in visible form, but these all are working because of some invisible forces. Okay, so just like a similar, our body, we have our body, and this is in visible form, but it's working because of some invisible forces. In the terms of modality, if we are saying that what is that invisible forces is electricity, definitely. It's working because of the electricity. So in the terms of our body, in the terms of our existence, our this body is working because of some invisible forces, and that is called energy body. So you can relate this energy body, this the energy body. You can relate this energy body this with your mind also. We are not able to see the mind, but it's working 24 into 7, and we are just moving everywhere with this mind, and we are experiencing it always. So there is some invisible forces because of this physical body is running. So to understand this energy body phenomena, then we can understand then how diseases happen and how we can cure it from the deep. Why we are using the term of healing here? Because management is very old thing. We are managing diseases, but we are not curing or healing the disease. So here we are here to discuss about the how we can cure or heal any problem. So to heal any problem, we need to first need to understand the human existence, which we already discussed that we are a human being, which is the physical and energy combination. So to understand that there is a obstruction of energy flow due to misalignment of body structures and accumulation of toxins. If there is in misalignment of body structures, because we are into the physical body, every structure has their own space, and if it is in misaligned state, or if there is accumulation of toxins, this is the sheet of any disease. So from the term disease, what we understand, disease itself says that disconnect from the ease. That means there is a one portion of your body which is an easy manner. So we are when we disconnect from the easy manner of our existence, we are converting in a disease state. So it affects the process of angiogenetic events inside the body and creates disturbances in neuromuscular coordination. So to understand this concept, first we have to discuss about the term of angiogenesis. So obviously, somewhere we heard about that in physiology and pathology, but never understood in very depth manner. So here we are discussing the term of angiogenesis. So what is this angiogenesis? Angiogenesis, that means in our body there is a lot of millions of cells. So our body is comprised of 60 trillion cells. We are the combination. Our this physical body is a combination of 60 trillion cells, and every cell require oxygen and some nutritional supplement to survive, to do their function. So the angiogenesis is a physiological term in which through the blood vessels. So if you're talking about the blood vessels, there is a 1 lakh kilometer of blood vessels inside the body. Literally 1 lakh kilometers of blood vessels inside the body, and just around 2000 crore of capillaries inside the body. And there is always a capillary just near about any cell. So our whole body is made by the cell, different kind of cells, because there is a bone cell, there is a muscle cell, there is a hair cell, there is a blood cell, that everything is made by the cells. Any structures is made by the cells, and there is a capillary near each and every single cell to feed that cell. Okay, the term angiogenesis, that means we have the intelligence, we have that our own intelligence, that which cell is needed more of blood supply and which cell is needed decrease of blood supply. Because our every cell doesn't require same amount of blood supply all time, so it requires different amount of blood supply depending upon their requirement. So if we see a lot of diseases, just like a cancer cell, what happens in the case of cancer cells? The cancer cells are feeding a lot. Okay, so there is a one term which is called autophagy. Autophagy is a term where the body stops the blood supply of that particular cancerous cell to prevent their growth. Okay, but when the autophagy mechanism shut down, when our autophagy mechanism shut down, our body is not able to stop the blood supply of cancerous cell, and only because of this, cancer cell can grow and it can affect our health. If we are seeing in the terms of arthritis, because in our sector, in our field, we are dealing with cases of arthritis, we are dealing in the cases of chronic pains, we are dealing in the cases of chronic psychosomatic dysfunction. So what is happening in this case? Literally, there is a lack of blood supply, and through the lack of blood supply, there is a decrease of oxygen of that particular area, and only because of this psychosomatic dysfunction occurs. Only because of the lack of blood supply, the joints are not getting enough their nutritional requirement, and only because of this, there is a dryness of joint and arthritis happen. And all these kind of chronic disorders, chronic back pain, chronic neck pain, all we are dealing in the case of there is a lack of blood supply. So body have intelligence that which part is needed more of blood supply and which part is doesn't need blood supply, more of blood supply. So naturally we don't our body is not structured to have disease, our body is not structured to have arthritis, our body is not structured to have any psychosomatic dysfunction. But when the mechanism of this angiogenesis has stops or disturbed, then only body lost the sense that this part is needed more blood supply, and because of lack of this sense, that particular area or joint of the body is lacking of blood supply, and because of this we are having arthritic changes, and only because of this we are having psychosomatic dysfunctions, and only because of this we have musculoskeletal problems. So this is the angiogenetic event which is very important, and when this angiogenetic balance is there inside the body's self-healing mechanism has activated, and body is not allowing anything to in misaligned state to be diseased state. Okay, so we can say that natural self-healing mechanism is inbuilt mechanism. Our every single cells are already programmed to heal itself. Our work, what is our work? If our every single cells are already programmed to heal itself, that's what we are doing here. We are doing our work is to create the right environment inside the body, and body knows better how to heal itself. So this is miraculous thing that our body, every single cells are already programmed to. So there is a self-healing mechanism already inbuilt mechanism in our existence. But because of some disturbances and because of some disturbed physiology, this mechanism has stopped, and because of this we are suffering. So through the manual medicine, we realign the structures and increase the blood flow to remove the toxins from affected area and allow the body to heal itself. Definitely, through manual medicine, what we are doing, we are just realign the structures, we just realign the joints and increase the blood flow of that particular area, which is the main cause of that particular problem. So through this, we are healing the condition. So through manual medicine, we can reactivate the right muscle at the right time, because all muscles have that sense that you can activate at the right time. Just like if we are doing shoulder abduction, so first 30 degree of the abduction, it requires some different muscles to activate. Then another 30 degree of abduction requires some different muscles to activate. Another 30 degree of abduction requires some different muscles to activate. And then to fulfill the movement, it requires some different muscles to activate. So there is a different muscles activation at a different time or at the right time. So through manual medicine, what we are doing, we can reactivate the right muscles at the right time and normalize the muscle firing and those realign neuromuscular coordination. So now the one very good thing to understand that till now or in so many decades we are using PNF to treat the neuromuscular condition or neurological condition, right? But now we can enter the concept that through PNF we can treat the musculoskeletal conditions. It's not only for the neurological cases. We can treat the through PNF, because through PNF we can increase the neuromuscular facility. We facilitate the neuromuscular coordination through PNF. So we can apply the concept of PNF to treat the musculoskeletal conditions also. And there is a vital force in the meridians. Meridians, that means nowadays a lot of meridian concepts come in our field. We are hearing that mass concepts, that anatomy trains, that there's a lot of meridians are there, and there is a lot of facial connectivity are there, and through that, our toe is connected with our head, and our head is connected with our toe, and our bodies, every part is connected to the meridians, and we can treat the head from the toe, and we can treat the toe from the head. So this comes in a concept of meridian, and the meridian concept is based on the facial structure, and to this fascia, the healing forces are moving here and there. Now we are discussing psychosomatic dysfunctions, because this is very familiar term of ours in our practice, the psychosomatic. So what is the meaning of psychosomatic? Name itself indicates that our psyche or mind affects the flow of energy and creates blockage in our energy. And if we are seeing the terms of mind, there's a lot of thoughts are coming in our mind, and emotions are also arise from the mind. So what is the meaning of emotions? That's energy in motion. So we can say that our body's every single part is connected with some particular type of. Our muscles are very sensitive structures. Our fascia and nerves are very sensitive structures, and our body's every single part is connected with some particular types of emotions. And we'll see further how different kind of emotions can affect our different parts of the body, and how we can treat. We are treating the manual things, but what we need to integrate more to feel better. Okay, so we'll see further how we can do this. Now I'm sharing the screen of quantum healing. Okay, so quantum healing, and the quantum healing, we need to understand the quantum. Till now, we studied the normal Newtonian based science or Newtonian based physics. Now the new concept has come, that quantum science. So what is basically quantum science or quantum mechanics, you can say? Quantum mechanics is a fundamental theory in physics that provides a description of the physical properties of the nature at the scale of atoms and subatomic particles. So what is the physical properties of the nature? If we see the universe, and we are also the part of universe, so our every single cell, our body is made by the cells, and in this whole universe, everything is made by the atoms. So what is inside the cells? There is an atom. Okay. So we are also made by the atoms, and everything in this universe is made by the atoms only. A piece of stone is not different from our body. I think it will be a little bit of depth, but just listen me And if you have any query or doubt, then we'll discuss definitely at the end of the session. So a piece of stone is connected with our body at the similar manner by which the piece of stone is made by the atom, and our body is made by the cells, and just inside the cells there is an atom, and just inside the atom there is subatomic particle, and just inside the stone atom there is subatomic particle. So what is that subatomic particle? Subatomic particles comprises of three particles which are called electron, proton, and neutron. Electron, proton, and neutron. So in this universe, everything is made by these three particles, which is called electron, proton, and neutron. So what is quantum science? The study of description of the physical properties of the nature at the scale of atoms and subatomic particles. At the level of atoms and subatomic particles, that is electron, proton, neutron, to study that is called as quantum science. Because our body is also made by these same structures, that's why we need to understand this concept, quantum science, to heal better in our life. So, in this quantum science, we'll discuss some topics just like under quantum science. So, first, we need to discuss about the wave and particle duality of any particle. Okay, so what denotes that wave and particle duality of the nature? Just like that, every single particle can behave like a particle and wave also at the same time. So this all matter will be having this dualistic character, and when it is being watched by an observer or being measured by observer, it changes its nature to particle instantly. So we are going to use observer node to use in our treatment as we being an observer of the action which has happened as wave in nature. So what we understand through this, we are understanding that any particle, our body is also made by the particle. So any particle, when we observe that particle, it behaves just like a particle. All matter behaves like a particle when we observe. So what we are doing in the treatment, we are observing the condition first. So here the trick is that quantum, according to quantum science, when we observe any matter in this universe, it behaves something different. So according to this science, uh, you can see that I'm saying that quantum thing. You can say this is great. According to quantum mechanics, reality does not exist when you are not looking at it. This means that the universe may not exist if there was no one born to observe it. That means if you are observing this universe, that's why this universe exists, otherwise it would not exist. So to understand that any particle or any matter can behave like a particle and can behave like a wave. When we not observing any matter, it can behave like a wave. And when we start to observe any matter, it behaves like a particle. To understand concept, you can write it down. One very famous experiment, which is called double slit experiment. And after this experiment, this quantum science comes in existence. That is, there is something different, and we need to understand it. Okay, so just note it down. Double slit experiment, because if I'm discussing here, the double slit, it will take too much time. So there's a limitation of time also. So you can write it down and you can watch that in video and some YouTube separately to understand that. So on the next, we are discussing under this quantum science is quantum entanglement. So as screen shows, what is quantum entanglement? So quantum entanglement enables particles to affect each other instantaneously across any distance. Entangled particles would remain connected even if they were on opposite side of the universe. What we understand through this concept? What is quantum entanglement? And when you understand this concept, now a lot of mysteries will just open it in front of you. Then how we can treat the whole body from the ear, how we can treat the whole body from the eyes, how we can treat the whole body from the mouth. how we can treat the whole body from the scalp, how we can treat the whole body from the palm, how we can treat the whole body from the toe. So quantum entanglement is it is a phenomena in quantum mechanics. What happens to a stationary object here instantly can affect an object at other side too without any connection. It says that if there is any matter available here, and if there is any other matter which is not nearby this matter, and it can be at the end of the universe, then it can affect each other at the same time. Doesn't matter how much distance is there. So it can be in multiple places at the same time. Further, if we'll talk about that, when two subatomic particles with different properties interact, they can become entangled. That means their spin, position, and their properties become mixed and linked through the process of entanglement. Okay. Once they are entangled, they will be responding to any change to one particle. The other particle will respond instantaneously. It is obvious that information has traveled faster than the speed of light from one particle to another. Till now, we heard that there is a maximum speed which is possible is the speed of light. But now, according to quantum science, the maximum speed in this universe, the speed of information, and this maximum speed can connect the matter from one end of the universe to the another end. And through this, when we treat one part of the body, how we are connecting these concepts in the treatment of our body, that when we treat one part of the body, so through one part of the body we can treat the another part of the body. Doesn't matter how much distance is there. That's why we are able to treat the head from the toe. That's like we are discussing here. Through fascia we can release the structures, but if we are seeing in the depth of little bit of fascia, so there is the concept of quantum entanglement, that if we are releasing the one area of fascia, so we can releasing the another area of fascia simultaneously at the same time, and we can treat the conditions better. And there is one another concept in this quantum science is quantum tunneling. So maybe this is the first time you heard about the quantum tunneling. So what is this quantum tunneling? And again, this quantum tunneling concept is also very important to read the conditions in our sector also. So just try to understand this. Any query, then we'll discuss at the end of the session. So quantum tunneling, what is the quantum tunneling is? There is a two kind of mechanics, that classical mechanics and quantum mechanics. So to understand the phenomena, particle attempting to travel between potential barriers can be compared to a ball trying to roll over a hill. As showing on the screen, quantum mechanics and classical mechanics differ in their treatment of this scenario. Okay, so what classical mechanics says, classical mechanics predicts that particles that do not have enough energy to classically surmount a barrier will not be able to reach the other side. If we are throwing any ball and if there is any barrier, okay, so it depends on our effort, that how much effort we are putting on the ball on throwing, that it will able to cross the barrier or not. It depends on our effort. This is classical mechanics says. But now quantum mechanics says something different. Quantum mechanics saying that these particles can tunnel to the other side, thus crossing the barrier. Is there is any possibility that ball can tunnel the barrier and pass to the other side? So according to quantum science, it's possible. This particle can tunnel the other side, thus crossing the barrier. For example, if you have a bump or a cut in your body, anywhere you can press the exact opposite side of the opposite side to reduce the pain and cut area. That means that it applies on both acute and chronic cases. Okay, so how it applies on acute cases? You experience or try to experience that when you have injury on the some part of the body, and there is pain, and there is bleeding. Okay, so what you have to do, because of the pain and because of the injury, because of the bleeding, you're not able to touch that area, but it's paining a lot. And try one thing now, just press the another side, this mirror side of the body of that particular area. If you have any injury on the main big finger toe, and if you press the same finger on the mirror side of the body, it can decrease the pain of that particular this side of the body, and it can decrease the if there is bleeding, lot of bleeding is there. So if you press the mirror side of the body on that particular part, the bleeding will stop in that area, and it's possible because of the quantum mechanics. Okay, so this is very new concept, and if you understand this, then we can treat the affected area of the body from the mirror side of the body on the same area. So if you have pain on the knee, on the right side knee, on the same area, if we're treating the left side of the knee, we'll get some. And it depends on acute condition, definitely will get results. But in chronic condition, definitely will get results. How much it depends on the concept that at the time of injury, what was the label of our concept. So we'll discuss later then how it affects the whole concept. So this is the concept of quantum journaling, and quantum physics tells us that we can discuss the little bit more about quantum science. That quantum physics tells us that nothing that is observed is unaffected by the observed. So if the patient is come to you and you are observing the cases, definitely it has some impact from the time when you observe the case, when you observe the patient. Okay. So quantum science says that nothing that is observed is unaffected by the observer. That statement from the science hold an enormous and powerful insight. It means that everyone sees a different truth because everyone is creating what they see. Understood? If you are believing that yeah, this condition is not able to treat proper, okay, so, or I'm not able to treat this case, so you're right in your personal perspective, because nothing can observe which is unaffected by the observer. So this is the concept of quantum science. And every matter in this whole universe vibrating on that particular frequency. If we are talking about the body structure, there is a lot of body structures are there. There is a bone, there is a muscle, there is a fascia, there is a blood, there is a lot of liquid structures, there is a lot of semi-solid structures, there is a lot of soft structures, there is a lot of different kind of structures. And we are talking, if we are talking about that every structure is meant by the same particles, then why every structures are behaving something differently? Some structures are behaving hard in nature, some structures are behaving soft in nature, some structures are behaving semi-solid in nature, some structures are behaving liquid in nature. So what is the difference between these structures? So the difference is in frequency. Every structure is vibrating on the different frequency. Okay. So because of the different frequencies, all structures or all matters are looking something different in nature or to see or in color. So there is a difference of frequency because every structure is vibrating on the different. And why diseases happen? Because they are not in tune with their natural frequency. When they are disturbing their natural frequency, it is in disease. If you are talking about the level of energy. Okay, so there is a difference of frequencies. So with the help of manual medicine, we can realign the frequencies of that particular structures to realign the structures and increase the blood supply to give the nourishment of that particular cells, by which we can improve the frequency of that particular cell and we can vibrate that structure on a natural frequency. Okay, so Albert Einstein, which is very famous, is saying that everything is energy and that all there is to it, match the frequency of the reality. What I'm talking about, match the frequency of the reality you want, and you cannot help but get that reality. You can be no other way, and this is not science and this is pure physics that whatever we want to achieve in life, whether it's a health, whether it's to cure any problem, we have to match the frequency of that reality. That means we have to match the normal natural frequency of that particular organ by which frequency they are vibrating at. And if we are able to match the normal frequency of that particular organ or structure, we are able to think and cure the case completely. So this is energy. And there is one more fact about the quantum science. Quantum physics proves that nothing is solid. If you are saying that okay, there is a piece of stone, there's iron, is very solid in nature. So quantum science is saying that nothing is solid. Okay. It proves that thoughts are what put together and hold together this ever changing energy field into the objects that we see. Our thoughts are linked to this invisible energy and they determine what the energy forms. Your thoughts literally shape the universe on a particle by particle basis to create your physical life. So, according to this concept, nothing in this whole universe, along with our body, is solid. Everything is in energy manner, and it proves that our thoughts affect the energy of everything. Okay, so further we'll discuss about that, how thoughts affect, how our mind affects our physical health, our physiology, our anatomy. So we'll discuss further in the concept of psychodeuroimmunology. So definitely we'll discuss about that. So you'll able to understand. Perfect. So now we are going to discuss about the psychoneuroimmunology. So I'm just taking a little bit of rest in the water. We want. So now we are discussing the concept of psychoneuroimmunology. So what is this exact psychoneuroimmunology? As name suggests that there is something related with psyche, which is also called PNI in the short form. And if we'll talk about the psychoneuroimmunology, so the definition is psychoneuroimmunology. PNI also called psychoindoneuroimmunology. PENI, which is deals with the study of the interaction between psychological process, the nervous and immune systems of the human body. Okay, understood? It deals with the concept of nervous system, immune system, and endocrine system of the body. And until 1970, it was thought among the modern Western medical community that immune system function without any influence from any other part or function of the body. So just before that, it was thought in medical community that immune system doesn't have any involvement in body functions and all in physiology. But now, through the concept of psychoneuroimmunology, this concept has established, and the founder of this concept is Dr. Robert Adler. Okay, so what is psychoneuroimmunology? So if we need to, if we are trying to understand the disease, what is disease? So diseases are the non-verbal reactions towards your body in reference to your mind. What is disease exactly? Diseases are the non-verbal reaction towards your body. Non-verbal reaction towards your body in reference to your mind. That means this is the way of mind that mind want to talk with us in the form of disease because directly it can communicate. So it communicates to having diseases in our body. So diseases are non-verbal reaction towards your body in reference to our mind. Okay, and if we try to understand the mind, we can relate with organization. You can see the organization. What is a lot of people are in organizations, just like CEO is there, and a lot of managers are there. So if we can compare our body with an organization in our body system, who is the CEO of our body? So these systems are the CEO or of our body. Whose three systems? Nervous system, immune system, and endocrine. And how they are managing our body will let us definitely tell you. So these three systems, nervous system, immune system, and endocrine system are the CEO of our human body. And what systems are working as a manager? So there is some systems who are working as a manager, just like cardiovascular systems working as a manager, genitourinary system is working as a manager, musculoskeletal system is working as a manager, and skin is working as a manager. So if we are talking, if we are relating our body with a country, so in our country, India, we have Prime Minister Modi ji. Modi. So in our body, who is the Prime Minister of our body exactly? So in our body, the role of Prime Minister plays the nervous system is working as a role of Prime Minister in our body, and immune system is working as the army in our body. Because to run the country, one PM is required, is very important, and army is required to protect the country. And third thing is a lot of media industries are required to send the information here. So in our body, the role of PM is played by the nervous system, and the role of army is played by our immune system, and the role of media is played by the endocrine. And these all three systems, nervous system, as name suggests, psychoneuroimmunology, or you can say psychoindoneuroimmunology. That means nervous system, immune system, or endocrine system. These are working as a messenger in our body. Okay, so our nervous system have a messenger of neurotransmitters. A lot of neurotransmitters are attached with our nervous system. Immune system have a messengers as a cytokine. There is a lot of T cells, there is a lot of B cells, and there is a natural killer cells, lymphocytes, WBC. So these all stuff are making immune system. Okay, so our immune system is cytokines and WBC, which are protecting our body from the attack of any foreign particles and from the diseases. Okay, and the endocrine system secretes the messages of a lot of hormones to different glands. If you have seen, there's a lot of glands are there, just like pineal gland, pituitary gland, thyroid gland, thymus gland, pancreatic gland. So these are a lot of glands, and these all glands are secreting a lot of hormones. So these hormones are working as a endocrine system message. Okay, so these three things are the working as a messengers in our body, and exactly how this concept is affecting our reality is mind affects the brain, because mind is not visible, brain is visible. Mind affects the brain, and in the brain there is a small structure which is called amygdala. Okay, there is a term amygdala, and it's a very small, just like pea-sized structure just in the center of our brain, which is called amygdala. And the main work of amygdala is to activate our fight and flight response, or to choose it. Just like our amygdala decides that everything is well or there is any danger. Okay, so if we are discussing about the mind, and if we can discuss and we can understand the concept of this, we will get the some depth knowledge about that, how we can cure the diseases and what is the source of diseases, how mind creates disease. So if we talk about this, um, our mind affects our brain directly, and in our brain there is small structure which is called amygdala, and amygdala is deciding that all is well, all is there is any danger. If I am talking about this, this concept, this is free. Okay, so if there is any external event is happening, okay, if there is any external event is happening, our mind decides that, because proceeding according to our beliefs and thoughts. There's a lot of factors by which we can decide to see the any events that this is in favor of us or this is okay. So there's a lot of information we receive from our five senses, and to our five senses we receive a lot of external information to our mind, and our mind on the basis of our values, our beliefs, our decisions, and our memories in past manner decides that this is danger situation or this is happy situation. Okay, for example, if there is any tiger in front of us, so is that necessary that tiger will attack us? It's not necessary. हो सकता है कि वो अभी जिस कुछ खा के ही आ रहा होगा और वो हम खड़े रहे और हमारे बगल से निकल जाए. It's not mandatory that it attack us. But we always think that if there is a tiger in front of us and it will attack us. So it depends our belief and previous जो हमने पहले का जो सुन रखा है उसके बारे में, उस पर डिपेंड करेगा कि हम एक माइंड को पैनिक मोड में डालेंगे और उसके हिसाब से एक्शन लेते हैं. So this is the example then how we react in the situation. So amygdala is deciding that all is well or is there is any danger. Okay, and amygdala receives the signals from five senses. And if you talk about the mind, uh, there is a lot of stresses in our mind. Just like that, to share this perspective, this screen, we are seeing the diagram, and that in the center there is stresses. Okay, which create stress on our system. Just like that, we have three systems. We always discuss about the nervous system, the immune system, and the endocrine. Okay, our nervous system is emitting a lot of neurotransmitters. Our immune system is emitting a lot of cytokines, and our endocrine system emits a lot of hormones. Okay, and if you're talking about the stresses, there is a three kind of stresses, which is physical, emotional, and chemical in nature. Okay, physical, emotional, and chemical in nature. So we, when these stresses are coming in our mind, our amygdala is responsible that how it's taking the situation that all is well or is there is something in danger. When our amygdala is deciding that this is all is well, there is no panic mode, so it activates our parasympathetic mechanism inside the body. Okay, and when parasympathetic mechanism activates inside the body, everything, every physiology of our system is working well. But when amygdala sense that there is danger, then it immediately activates the sympathetic systems in our body. And when the sympathetic systems activates in our body, it affects our hypothalamus. And there is one more thing which is very important for amygdala is our amygdala is not able to differentiate that any situation which is in real in nature or unreal in nature. Just like that, our amygdala is not able to differentiate that if we are watching a tiger in front of us. So this is the reality that tiger is standing in front of us. But if we are seeing any movie and if there is a tiger in the movie also, so our amygdala is not able to decide that this is in real or this is unreal. Okay, if our amygdala is saying that in the movie there is a tiger, then again it activates our sympathetic mechanism and affects our whole physiology inside the body. Okay, so that's why amygdala is very important. So amygdala affects the hypothalamus, and hypothalamus releases a lot of stress hormones, which is called adrenaline, cortisol, etc. What adrenaline and cortisol does with our body? It's very important when there is danger. Okay, because what happens when secrete this hormone? Uh, when secrete adrenaline and cortisol inside the body, it increases our BP first. Okay, and it increases our blood sugar also, and it increases the fat level also. It, it increases the fat level also inside the body. And what happens exactly inside the body when these structures, adrenaline and cortisol, secretes inside the body? the whole blood supply. Because in our body system, what happening? Uh, if we can divide the whole body from three different segments, just like this is our upper part of the body, this is our center part of the body, and this is our lower part of the body, and we can decide the body in upper part, middle part, and there is limb part, which includes hand and both. Okay, so in normal situation, what the exact things happen? Whole blood of the body focusing on our digestion middle part of the body. Okay, and it assists a lot of physiological functions in our central part of the body, because all physiology is managed through this center part of the body. So it requires a lot of blood supply to work. And when amygdala is tense, there is danger, and when there is adrenaline and cortisol releases inside the body, what happens? The whole blood from the center area is shifted in our limbs, in our legs, in our hands. And now the concept is coming in front of us in fight and flight response. That in the danger situation, what we'll do, whether we fight with the enemy or whether we escape from the enemy. So for the both purpose, we need the blood supply in our limb. अगर हम fight कर रहे हैं तो we require a blood supply, a lot of blood supply in our legs and in our hand. And if we are escaping from that situation, then we need a lot of blood supply in our legs and in our hand. So automatically our system uh, supplies shifted the blood from our center area to our limb to uh, find that situation. But as we already discussed, that our amygdala is not able to decide between real and unreal. Okay, so when there is in reality, then if there is any danger situation and we need to escape or fight, it's very important that we need blood supply in our limb. But if you are seeing a movie, suppose if you are seeing a movie and our amygdala is sensing that there is danger, and it shifts our blood in our limb. But with watching movie, we don't require to escape or fight. Okay, so but the whole circulation of the blood is in our limb. So what happened in case unnecessary, our center part of the body is lacking of that blood, which is very important to manage the physiological conditions inside the body. And unnecessary if the blood is moving in our limb, and which is not required on that particular time. So what's happening in nowadays? Why diseases are so common, and again we are affecting with new kinds of diseases, and there's a lot of patients are there which is having a lot of diseases. So the main reason is our mind is continuously in stress mode. Our amygdala always sense there is a danger, and it always nowadays what is happening 95% of the time our synthetic mechanism has activated, because we are watching something. So from that we are sensing there is danger. We are listening something, from that we are sensing there is a danger. We are reading something, from that we are, because there's a lot of negativity around us. So our amygdala is always in sympathetic mode, and sympathetic when sympathetic mode is activated, and nowadays 95% of the time our sympathetic mode has activated, and only because of that our the blood always remaining in our limbs and our legs, and we are always ready to fight and flight. And this is the reason that our because of excess of blood in our legs, because of excess of blood in our hand, uh, the muscle mechanism, the balance between our physiology and psyche has disturbed, and because of this we are having a lot of issues physically or mentally. Okay, so through this we can understand the concept of psychoneuroimmunology, and now we'll discuss a little bit about immune system, how our immune system works. That when there is any attack from the outside, our immune system does two, whether it suppress itself or whether it's overreacted. Okay, so when it suppress itself, what is happening exactly? Just excuse me. Then in immune system, if we're talking about the immune system, whether it suppress or whether it overreact. When we are in the peak of any state, just like we are the emotional being and our mind gets a lot of emotions. So now we are discussing how this immune system works according to our emotion. So when we are in the peak of any state, whether it's fear, anxiety, happiness, panic, or stress mode, etc. At that time, our immune system will either suppress or overreact. And at the same moment, if we suppose eat wheat chapati, there's a lot of allergies nowadays. Why there's a lot of allergy? Why there's a lot of allergy conditions coming? Because when our mind in peak state, अगर हम गुस्सा कर रहे हैं और अगर हम बहुत गुस्से में हैं, अगर हम बहुत हैप्पी मूड में हैं और हम बिल्कुल पीक में हैं और उस टाइम पे साइमल्टेनियसली if we are eating chapati, okay, so that whole our immune system working just like that. If it overreact, okay, at the same time, if it overreact, then it suppress that it will just anchor the chapati with the overreaction. तो उससे क्या हो जाएगा कि जब भी हम चपाती खाएंगे तो we find that we have allergy with the chapati. We find that we have food allergy, we find that we have milk allergy, or there's a lot of allergical food. So there is not allergical food, but the process is that when we are the peak of any emotional state, and if we are doing something, or if we are eating the same time something, and our mind, our subconscious mind can connect the same food items with that overreaction. That's why our immunity overreacts and a lot of allergic conditions come to exist. Okay, and when it suppresses, so during panic situation, but what we already talked about that is from the center area it shifts in our limbs. So now we can talk about that happy chemicals also. There's a lot of happy chemicals inside the body, just like dopamine, serotonin, oxytocin, and endorphins. So these are the happy chemicals which are secreting inside the body. When amygdala sense that it is all is well. So when parasympathetic mode activates inside the body, it releases a lot of happy hormones, just like dopamine, serotonin, oxytocin, endorphins, which is needed for healthy body. Okay, so so these process, our mind sense that which mode has activated, that sympathetic or parasympathetic. So this is all the concept of, you can see the screen that external event is happening and our mind on the basis of values, beliefs, decision and memory carry the perception according to their state, and according to that perception mind state has changed, and according to the state our physiology affected, and according to the physiology our behavior affected. Okay, so these we can see how stress can affect these all three systems. So our physiology affected by our psychology. So directly there is a direct connection between our psychology and physiology. You can see that in the effect of different emotions in energy body. So we can see the effect of anger in our energy body, and these all we can. There's a lot of new technologies has come now. One is trillion photography, through which we can scan the energy body also, that which emotions is stating how much impact on our energy body. So this we can scan from trillion photography. So definitely we can now we can scan the effect of emotions. So these all are fully scientifically proven concepts. These we can say is how stress creating affects our physiology. And through this screen we can see which already we are talking about, our every single structure have particular frequency and they are vibrating on the particular frequency, and this is the diagram of spine that showing that our every single spine have particular frequencies, and if you want to treat that spine or align that structures, we need to retune the normal frequency of that particular vertebra. So we can see in this in screen, there's a lot of frequencies are available there. So now we'll discuss the application of PNI, psychoneuroimmunology, in the muscular system, because our muscular system is very sensitive. And when we understand, and we already discussed that every emotion, our every part of the body is related with, connected with some particular types of emotions. So now we'll see how our different kind of area of the body is affected by some particular types of emotions. So in this diagram, you can see a brief overview that how emotions affect our body parts. So we'll discuss one by one, just like that, our back. Okay. So here we are talking about the back. You can say your back is your storehouse for material protection and support. So in, if we see our back, it supports the body. There's a lot of muscles, there's a lot of groups of muscles in our back, and the main area, just like कहते हैं ना कि कमर टूट गई है, just like that. So this is the back pillar of our body, which protect and support our body. When we feel emotionally, there is no protection in towards me, and there is no support for me. There's a lot of betrayal. So these kind of emotions can affect our back. So that's why the storehouse of betrayal, protection, and lack of support affects our back. Our glute. Our glute is structure, and it store a lot of aggregation and separation. What happens exactly if you are not able to communicate properly? Okay, if we have some confusions with someone, and if you are not able to communicate, if you are not able to deliver our perception, our concept to that front people, so what we are doing, we sit down. Okay, and what happened in that case is exactly these aggregations and separations will affect our glutes and creating a lots of energy blockages in the glutes area, and affect the energy flow of that particular. So our glutes is related directly with aggregations and separation. Now come to our legs. So legs are the storehouse for moving forward and staying stuck. Just like that, uh, to in our body, what the leg is doing, leg is moving, is help to moving us forward. Okay, through the hip, through the knee, through the ankle, we are moving forward. So it connects the emotional component in life also. If we are not able to move forward in our life, if we are doing, if we are just feared to do some new work, some new startups, and some new, anything new. If we are feared to do something new, it affects our leg area, just like our hip joint area, our knee joint area, our ankle area. It affects the leg. So that's why storehouse for moving forward is staying stuck. So if we are not comfortable to move forward in life, so definitely your these leg joints will affect. And this is our abdominal muscles, diaphragm and psoas muscles. The storehouse for real vulnerability life. If we are see the all muscles, these are in our center of the body. Okay, and if we are talking about the psoas muscle especially, so there is also called that muscle of the soul, or this is very important muscle to blocked energy, for the blocked energy. This is very important. Why it is very important? Because if we are divide our body in two parts, upper part and lower part, and this psoas muscle connects the upper and lower part of the body, and it connects the spine with the femur directly. Okay, and what happens अगर हम डरे हुए हैं, if we are in fearing state, what happens exactly if someone is suddenly come to us and just do how? What we are doing, we are just contract our body. We are just contracting our body. So in this process, our this horse muscle in our center of the body. Okay, and because of this fearing state, our tendency is to protect ourselves. So because of this, there's a lot of energy blockages in our body. Okay, and Definitely with the psoas muscle, there is abdominal muscles also, there is diaphragm also. So when we feel vulnerable in our life, so our this area will get affected. Now we're talking about the arm, shoulder, and hand. So what we are doing to these structures, we are investing love and claiming vitality. So definitely we are reaching something, and we are when we feel lack of love and vitality को जब हम lacking करते हैं, when we feel the lack of the vitality in our life, our hands and shoulders affected definitely. Uh, this is the chest area, our storehouse of heart of the matter. If you're talking about our upper back, so always there is a say that कंधे पे जिम्मेदारी आ गई, कहते हैं ना, कंधे पे जिम्मेदारी आ गई. So when we feel responsible for something and we are not able to handle that responsibility in proper way, it creates blockage in our upper back area, in our chest area. Okay, so these emotions will affect our this area. So these emotions are coming in a mind, so that's why indirectly mind affects our upper back area through this manner. If you're talking about the head, face, and jaws, so these areas are responsible for gaining clarity and wider vision. So if you're not, just like for eyes only, if you're not able to see the future in life, it's not meant that everything should be the visible in our life. There's a lot of stuff which we need to see, uh, which is not visible. Okay, when we making a plan for our life, so we need, definitely we have to see something beyond the boundaries. And if you're not able to see the beyond boundaries, it affects our eye muscles, it affects our face muscles, it affects our store. That's why it have a storehouse for the getting clarity and wider visibility. Again, our neck is responsible for flexibility and awareness and claiming your life. Just like that, uh, for the neck, what it is in the top of the body, and it keep your head erect always. So if we are in life, we have emotional trapping that we are not feeling flexible. We are not flexible in nature. We are not aware about the things very clearly. So it affects our the neck area. So these emotions affect our neck area. So now we are moving towards the next segment of our presentation, which is the principles of manual medicine. If you're talking about the principles of manual medicine, so till now, which I said in the beginning of the session, is everything at the end will connect the dots. So now just connect the dots. Principles of manual medicine. So the first principle of manual medicine is the body is a functional unit, an integrated unit of mind, body, and spirit. Just like that, our body is a one functional unit, and all things are integrated: mind, body, and spirit. So body is a physical part, and mind is our energy part, and there is spirit part also. So body is a comprises of mind, body, and spirit, which is called human being. We already spoke about that, human being. Okay. So this first principle supports our human being concept. We already discussed that. And second principle is the body possesses self-regulatory mechanism having the inherent capacity to defend, repair, and remodel itself. We already discussed that our every single cells are already programmed to heal itself. Our work is to create the right environment. Body knows better how to. So what we are doing through the manual medicine, we are realigning the structures. We are increasing the blood supply of that particular area, and our body knows how to heal it. So that this is self-regulatory mechanism inside the body already. And the third principle is structure and functions are reciprocally interrelated. Definitely, our structure, that means anatomy and physiology, these both are interrelated in it. And the fourth principle is rational therapy is based on the consideration of the first principle. Everything is connected in this whole universe, that all single cells are connected, and we can treat the one part of the body to another part of the body. So these principles clear that concept also. So these are the principles of manual medicine, and through these principles we can improve our practice better. And if these three principles are always in our mind, we can make the plan better to treat, to heal, to cure any conditions perfectly. Now we'll discuss the 5 models of manual medicine. And there is a lot of models, which is behavioral model, metabolic model, neurologic model, respiratory circulatory model, and so what is this behavioral model? Behavioral model improve the biologic, psychological, and social components of the health spectrum. Okay, so till now we're discussing a lot about the mind. So this model is related to that behavioral model, that means our mind affects our physiology or it affects our anatomy also. So behavioral model is denoting with this one. Second is metabolic model. Metabolic model, that means it supports our self-regulatory and self-healing mechanism to foster the energy conservation by balancing the body's energy expenditure and exchange, and to enhance immune system function, endocrine function, and organ. So it supports our psychoneuroimmunological concept, metabolic model. Okay. When an individual has a musculoskeletal injury, they will utilize more energy to perform physical tasks. So definitely, if there is injury, there is overfiring of the muscles of that particular area. So it requires more energy to perform the task with improved structure and function. When we realign that particular structure and improve the pressure of that particular area, so through this we can decrease the firing of the muscle and through this we can heal the body. And third model is neurologic model. Neurologic model attain autonomic balance and address natural reflex activity, remove facilitated segments, decrease afferent nerve signals, and heat. The application of manipulation. If we are talking about the manual medicine, then we are manipulating the joints. So the application of manipulation in treating patients can decrease pain by directly influencing the nerve supply to the dysfunctional part of the body. Now another model has come that's called respiratory and circulatory model. So improve all diaphragm restrictions in the body. Through this model, we can improve all diaphragm restrictions in the body, and through this we can improve the oxygenation level in our body, and through oxygenation level in our body, we can moving the body towards the alkaline in nature, and through alkaline, maintaining the alkaline and acid and alkaline balance, we can maintain the good health. And the final model is structural model. Structural models denotes that biomechanical adjustment and the mobilization of this. Obviously, we are seeing the biomechanical stuff in our body and mobilizing the joints to uh, treat the musculoskeletal condition. So these are the 5 models of manual medicine, and that's all. These all topics now completed. And thank you so much for listening to me. And if you have any doubt or any query, then definitely thank you. Hello.
Hello. Yes, thank you, sir. Thanks a lot
Hello. Yeah.
for such a great elaborative session on the much needed topic and the healing by the manual medicine. We had learned a lot and very new things we had learned in the session. And it was really a great
Yes.
elaborative and well explained session by you. And as you already had declared, that, if anyone has any queries, they can write down in the chat box, then we can entertain the queries. If anyone has any
Okay.
queries regarding the session. And this session was really, sir, outstanding. And we had the participants from around 3 countries for this session. We had the participants from all
Okay.
areas of the country. We have some participants from the UAE, from some from Malaysia, from Pakistan itself, and I think one participant is there from even Bangladesh also. So it was really a wonderful and great session, and we are really much thankful to you for your such a great elaborative session on the topic.
Yeah.
Yeah, and again, I would request the participant, if they have any query, they can write down that, then we can entertain the
Yeah.
queries.
Surely. in the open manner, we can discuss any each single perspective which I'm explaining here. So please, if you have any doubt, then ask the question.
The session was really well explained and well elaborative. I think there's no such queries available in the chat box. And I'm really,
Okay.
really much thankful to you, sir, for such a great session with us on the board. And we are also
So how many
thankful to,
participants are there?
yes, sir, please.
How many participants are there?
I think there are around about 20 participants have joined us. And actually, there's some connectivity issue, though they maybe have disconnected or else. So I'm
Okay.
really
So
again,
we will get the recording of this.
yes, sir, there's one query from
So this
Pritam.
what are all I missed that very.
So there's some voice break at your end, please. I think there may be a network issue.
Okay, okay, okay.
There's a query from Pritam Haldar that what
Okay.
are all the treatment procedure and manual medicine?
In manual medicine, there's a lot of concepts that already we are doing a lot of chiropractic concepts. We are doing a lot of osteopathic concepts. We are doing a lot of physiotherapy concepts. So these all comes under the purview of manual medicine.
Thank you.
Because
Thanks.
finally, what we are doing through the help of this all concept, we are releasing and realigning the structures, and finally, we are improving the blood circulation on that particular part of the body to heal the condition. And we are proud that we are doing these all steps to the man. So
Great.
this is the wonderful part. Yeah.
So thanks a lot for answering the and solving the query, sir. Uh, is there any other queries? They can write down the chat box. And I'm also very much thankful from the team Physio Inculcator that the lot of senior physical therapists and academicians had also joined us, and we are really much thankful for their continued support, love, and blessings. I'm also thankful to my teacher, mentor, Dr. Harsh Rajdeep sir, Dr. Charu Sharma ma'am, and Ritu Rajdeep ma'am. And I'm also thankful to the Dr. Amita Anup Sharma ma'am. She's a senior physical therapist working at Yanubu, Dubai, UAE. And we are also thankful to the Dr. Nanda Kumari. She's also a clinical therapist at the Malaysia, and many other senior physical therapists had also joined us. Dr. Rajesh Suresh Babu sir has also joined us. We are really thankful to them, and much thankful to all the participants who joins us and support us for this effort to share the knowledge during this COVID-19 lockdown. So thanking you all. Much thankful to the resource person that this is all possible because of their support and the blessings and the efforts they made to share the incredible knowledge with the participants. So really much more thankful to you, sir, and grateful for your such a great elaboration on the topic, and hope for the such contribution in the future too, if it is possible to you, possible at your end.
As explained, it was simple and clear, right?
Yeah, yes, actually there was some voice break, sir. Yes,
Whatever I have explained that these
yes,
all
sir.
are clear and or simple and understandable, right?
Yeah, actually there was a bit of voice problem was there, but it was understandable.
Okay.
Sometimes there is a noise, extra noise was coming, maybe the network issue, actually that is not in our control. So but the voice was
Okay. Okay.
at least understandable, so there is no such issue. And I'll also upload the session on the YouTube. Hope while uploading the noise problem may be some corrected. So
Okay. Nice.
so this was really a great session, sir, and we are really much more thankful to
Thank
you
you.
for sparing your precious time in spite of having such a busy schedule. So thanking you, sir. Thanks,
Thank
thanks a lot, and thanking you for the all participant for joining us. And we'll meet again tomorrow at the 9 p.m. for the next session on the athlete's left ventricle by Dr. Sahanawaz Gaji sir. So we'll meet again tomorrow at the 9 p.m. Till then, stay safe, take care, stay tuned. Good night. Bye bye.